Paramedic Sarah arrived at a suburban home on a cold evening. Mrs. Evans, in her late 60s, felt dizzy, nauseous, and had a headache. The heating was on full blast. Sarah attached the pulse oximeter to Mrs. Evans's finger. The screen showed 99% SpO₂. "Your oxygen is great, Mrs. Evans," Sarah said, feeling relieved. But doubt crept in. Mrs. Evans's pale skin and confusion didn't match the reading. The signs were out of sync with the perfect oxygen reading. Her husband mentioned their old gas furnace acting up. Sarah noted this information. The 99% reading kept pulling her focus. "It's probably just a bit of flu," Mr. Evans suggested. Sarah checked Mrs. Evans's pupils and asked about other symptoms. The patient's answers were slow, and her fatigue was profound. The gap between the reassuring number and the worrying signs grew wider. Sarah recalled her training on less common emergencies. Cherry red skin is a sign of carbon monoxide poisoning, but Mrs. Evans' skin was pale and ashen. The headache, nausea, and dizziness were textbook symptoms for CO poisoning. The high SpO₂ reading was confusing. Pulse oximeters are usually reliable. The environment, faulty furnace, and cold season started to click together. This scenario plays out in countless homes and emergency rooms. It highlights the insidious nature of carbon monoxide poisoning. The pulse oximeter can become an unwitting accomplice to this silent killer. That 99% can lull clinicians into a false sense of security. This can delay life-saving interventions. Numbers on a screen are only part of the diagnostic puzzle. Sometimes these numbers tell a dangerously incomplete story, masking a critical threat to a patient's life. Pulse oximeters have revolutionized patient assessments. These non-invasive devices provide instant SpO₂ data. They offer quick, seemingly definitive respiratory status information. In emergencies, they quickly identify hypoxia. This makes them standard in emergency settings. A good SpO₂ reading, like 98% or 99%, is reassuring. This number can narrow our diagnostic focus. Normal oxygen saturation might lessen perceived urgency. We are trained to trust our instruments, but over-reliance can turn it into a crutch. Pulse oximetry has limitations, like in carbon monoxide poisoning. The ease of SpO₂ can discourage deeper thinking. This can lead to incorrect diagnoses and delayed treatment. SpO₂ is just one piece of the diagnostic puzzle. Clinicians must consider the broader clinical picture. Consider the Miller family. It was a cold January weekend. The Millers felt unwell. They had headaches, nausea, and fatigue. Mrs. Miller suspected the flu. By Sunday, Tom was lethargic and confused. Mr. Miller took him to urgent care. A nurse used a pulse oximeter. It showed 98%. "His oxygen levels are good," she said. The doctor diagnosed a viral illness. They were told to keep Tom hydrated and rested. No questions about their heating system. The SpO₂ reading reassured them. They returned home, unaware of a carbon monoxide leak. The gas continued to leak. Each hour increased their exposure. They thought it was a common illness. This shows the need to consider environmental factors. Clinicians must consider all possible causes. Pulse oximeters can be misleading in carbon monoxide poisoning cases. They measure light absorption by hemoglobin to determine oxygen levels. Hemoglobin absorbs light differently based on oxygenation. Carbon monoxide binds to hemoglobin, forming carboxyhemoglobin, COHB. This bond is over 200 times stronger than oxygen's. Even small CO amounts can displace oxygen, reducing oxygen carrying capacity. Pulse oximeters can't differentiate COHB from oxyhemoglobin. They interpret COHB as oxyhemoglobin due to similar light absorption. A patient with high COHB can show a normal SpO₂ reading. The device isn't malfunctioning, it's limited by design. It detects saturation but not the saturating gas. This can falsely reassure in CO poisoning cases. The device sees a bright red signal, masking true oxygen deprivation. Clinicians must use other diagnostic tools. Understanding pulse oximetry science is crucial to recognize its limitations. Given the unreliability of SpO₂ in carbon monoxide exposure, clinicians must focus on the overall clinical picture. Symptoms are paramount. CO poisoning often presents with vague, flu-like symptoms. Key indicators include headache, dizziness, nausea, and fatigue. Severe cases can involve confusion, visual disturbances, chest pain, and loss of consciousness. Environmental clues are critical. CO poisoning incidents increase in colder months. Inquire about the type of heating used. Ask about gas appliances, blocked chimneys, or power outages. Similar symptoms in multiple people from the same household should raise suspicion. Specific diagnostic tools are needed. The gold standard is a CO oximeter. Blood gas analysis can measure COHB levels. These tests confirm CO exposure and guide treatment. A high index of suspicion is crucial. Consider CO poisoning with non-specific symptoms. Do not dismiss CO exposure with a normal SpO₂ reading. Trust your clinical judgment. If symptoms seem inconsistent, dig deeper. Consider invisible threats that technology can't reveal. The Miller family's ordeal worsened before it improved. Tom's condition deteriorated and Mrs. Miller collapsed. Mr. Miller called emergency services again. A different paramedic crew noted the collective illness. They inquired about the heating in their home. A portable CO detector revealed the unseen enemy. The entire Miller family was rushed to the hospital. They were treated with high-flow oxygen. Tom and Mrs. Miller required hyperbaric oxygen therapy. The experience left lasting scars. Tom experienced learning difficulties. The family faced significant emotional trauma. The Miller case highlights the value of clinical intuition. These skills must take precedence over technological readings. Tom's initial SpO₂ reading of 98% was misleading. The symptoms, the cold season, and the gas furnace were crucial clues. Technology is an assistant, not a substitute for clinical judgment. CO poisoning wears a clever disguise, and the pulse oximeter can be an unwitting accomplice. Maintain a high index of suspicion for CO poisoning. Trust your clinical acumen to save lives.